Good evening and welcome to the regular August 10th meeting of the Commission on the Status of Women. Ms. Baboumian, will you take roll call, please?
Commissioner Katafian? Commissioner Lamel?
Yes.
Vice Chair Manasarian?
Here.
Commissioner Malakian? Commissioner Marakat?
Here.
Commissioner Pillsbury?
Here.
Commissioner Sobey?
Here.
Commissioner Walker? Chair Devine?
Here. Next item, please.
For the record, I'd like to say that Commissioner Katafian's absence is excused this evening.
Thank you.
At 1A, we have the report regarding the posting of the agenda. The report regarding the posting of the agenda. The agenda for the August 10, 2009 meeting was posted on the bulletin board outside of City Hall on or before August 7, 2009.
Thank you. Next item.
At 2A, we have Camille Levy of Glendale Healthy Kids, and she's here to talk to us about her upcoming fundraiser, Guess Who's Coming to Dinner. Ms. Levy is the Executive Director of Glendale Healthy Kids, and she wants to talk to us about her organization. And I'd just like to say thank you to Ms. Levy for supporting Camp Rosie this afternoon. She was there, and she spoke with the girls, so thank you for your support.
Thank you. It was a fun afternoon. I really appreciate the extra time that y'all are giving us this evening to share a little bit about our story. And what I'd like to show first is our PSA, which is running on KCBS and ABC TV. And should be able to just
Lower the lights, too.
Sure. Okay. Minor technical difficulties,
Okay.
like you really need to hear the PSA to know what it's saying. However, what I really would like to ensure is that people, particularly in this day and age,
I think we've
just
got
had
it.
Good. Go ahead.
Okay, let's go.
I have a passion for helping people. That's why I became a dentist. Unfortunately, these days, many children don't have access to the services they need. Glendale Healthy Kids fills that gap and provides access to free medical and dental care to those who need it most.
Thank you, Glendale Healthy Kids.
Glendale Healthy Kids started in about 1994 as a collaborative effort between the 3 area hospitals and the City of Glendale and the Glendale Unified School District as a means to address the unmet health needs of the children of our community.
Instead of receiving primary health care from a physician, they were ending up at the emergency room. They were being treated by school nurses. So Glendale Memorial Hospital and the Glendale Unified School District, also the Vertigo Hills Hospital and Glendale Adventist got together and decided to create a program which would help children.
There are a lot of children and families out there who may have medical coverage but no dental coverage, who may have emergency Medi-Cal but not regular Medi-Cal for regular care and follow-up and treatment. What's unique is that we do serve this group of the underinsured to help them get the full spectrum of healthcare services.
There are very few programs like this that provide care for children who fall into the gap of not having other means of securing medical care.
There are members of a low-income family that don't have access to health care, and these are the kids that we reach out to, and Glendale Healthy Kids has done a phenomenal job of reaching out to them medically and also educating them in a lot of health issues.
And it's amazing to think what a few people can do, what a handful of community groups can do when they work together for the same goal. It takes a real sense of optimism, and it takes determination for a small group of people to solve a problem which seems to be baffling our national leaders.
The problem with uninsured in this country is not likely to go away anytime soon. Glendale Healthy Kids has a unique approach, unique way of reaching children, helping them obtain access to medical, dental, vision, mental health services that, again, they would go without.
We don't feel that there is a single child that should have to go without health care.
I was recently laid off. I'm unemployed. I have very little money. My son here is 4. His name is Mark. Hi, Mark. Say hi.
Hi.
And my son developed an eye infection about 3 weeks ago. Very severe. It was bothering his eye. The little I know about eye infections, I looked it up on the internet. And it's called a stye. And he had something called a chalice. Don't quote me on the wording. I may be wrong on it. And it developed and it got bigger and bigger, and he couldn't see very well. And my wife and I got nervous, and they referred us to the Glendale Healthy Kids program. I was very nervous to walk into there. I felt intimidated due to the fact that I have no money. What if they ask for money? I thought I was going to have to fill out long forms or wait hours with my son there. But to my surprise, and I'm so thankful for that, there was no long forms, there was no hours of waiting. We were there for 5 minutes and they already had an appointment for us an hour later after the 5-minute, just simple talk. It wasn't even an interview, nothing like that. It was just simple a talk. And they saw my son and they told me they could help me. And they had an appointment for us an hour later. And not only did they have an appointment with a real doctor, a good doctor, they gave us medication as well for his eyes, and it was at no cost, and they made me feel very nice, very good. They helped me. They actually helped. They didn't interrogate me, anything like that, and they were very nice to my son, and they helped us with his problem with his eye.
My name is Maria Trejo. I am Joshua's mom. Joshua has problem with his teeth, and I really looking for help. And one friend of mine told me about Glendale Healthy Kids, and really excited about try to find help for him. He has some issue in school because the kids mention around his teeth. And in home too, we have some problem there, but as to see these beautiful braces now, and he will be nicely smile. I need this opportunity for say thank you to Healthy Kids program. I really appreciate. It's very great program. It's helped me too much. Okay, and everybody there is a kind person too.
Helping these children has been the most gratifying experience in the world for me. It's just, they're so innocent. When they're coming in here, they don't know what to expect. They're just so grateful to you.
There's no higher calling for people on earth than to help others. And what better group of people to help than children? Because they're impressionable, they're kind, they're loving, they're trusting, and I love to help kids. And I thought Glendale Healthy Kids would be a great place for me to be.
Being part of Glendale Healthy Kids, a nonprofit organization, always means that you're giving part of your time, part of your services, as well as part of your heart, because it's all about giving and not getting something monetarily back, and that's the ultimate personal satisfaction in my part.
I think whoever is involved is a winner, because we do get something back, and that is really a positive reinforcement and emotional fulfillment, so to speak, of what we do. Is because it's all about helping our community, helping our children, the most impressionable members of our community, and also setting an example for them, so in the future they could be, helping others like we are helping them.
What I enjoy about Glendale Healthy Kids is knowing that I'm a part of this community of caring people who are solving a crisis, a need that otherwise would go unmet.
I'm proud to be a part of Glendale Healthy Kids because it works. In our community, we have a small group of volunteers, a small staff. We have providers who donate their time. We have a school district who supports us. And in our area, we're able to fill the gap, which is no small thing. I'm really proud to be part of that.
Working for Glendale Healthy Kids is a very rewarding experience. Often when you have parents or families or children writing thank you notes, telling you how you've made a difference in their lives, it's a very fulfilling experience. It's not always that you get to work for an organization that makes such a big impact in children's lives.
I have a letter that I keep in my notebook. And whenever I'm reminded of why I want to be a part of Glendale Healthy Kids, why I volunteer my time, I take it out and I look at it. Now, this letter was from a young man who was treated at the USC Mobile Dental Clinic several years ago, and he's an adult now. And a couple of years ago he wrote and he said to us, "There is not a day that goes by that I am not thankful for all that you have done for me. I learned that there are people and organizations that care about kids like me. Your work and kindness not only saved my life, but it saved so many others." So this young man tells us that if it weren't for what we were able to do for him, he felt like he was going to one of two places. One was Forest Lawn, and the other was prison. So it's a small thing to us when you think that just having good health could mean so much to a young person. But this was a young boy who had lost both of his parents. He just didn't think that there was anybody out there that could care for someone like him. So that's why I'm happy to be part of Glendale Healthy Kids, and I'm happy to do whatever I can as a volunteer, because I don't know how many other young people out there are going to benefit the way this young man did.
This past year, we are very proud of the fact that we kept 27 children out of the emergency room. There is an average cost of $7,000 per ER visit, and we feel that we've saved the taxpayers almost $200,000. We are looking at expanding the numbers of kids that we serve. Again, this year we provided over 1,200 units of service with 250 volunteer healthcare providers. However, as things change in Sacramento and in Washington, We are finding that kids that we did not need to treat before, those who had full scope Medi-Cal, we are now having to provide vision services because Medi-Cal has cut vision screening and vision services for kids. And we don't know what else is going to be cut. We already know that we're getting kids who are unable to access Healthy Families coverage. So it's very important for our community to support Glendale Healthy Kids as we support the kids who then can learn pain-free, can learn and be successful and come up to replace us. Hence, one of our upcoming fundraisers, which is happening on September 19th and 20th. And what I gave to each of you was our latest newsletter so that you could read about the things that we are doing, as well as an invitation to our guest who's coming to dinner. It is one of the fundraisers that provides almost 10%, actually 20% of our income. And we really appreciate the support of the community because it's the support of the community that then allows us to serve the kids. So take a look. Oh, and I also included one of my e-news newsletters because this month it has some stress tips. And I figured in August, by the time August rolls around, people might be a little stressed. So there are a few tips on how to handle stress in a healthy way. So I want to thank you for the opportunity, number one, to tell you a little bit more about Glendale Healthy Kids, to let the community know that there are options out there for those parents who have kids who have medical, dental, mental health, physical therapy needs, even into surgeries. And it does not cost the parents. And we do not receive government funding, so we can be a little more lenient on our guidelines and the kids that we serve. With that, any questions?
Thank you, Camille. Before I open it up to the Commission, I'd like to take note that Commissioner Walker and Commissioner Malakian came in and are now present. Okay. Any questions from the Commission? I'll open it to the ladies.
Other than I've been to this event several times, and it's just a wonderful, wonderful evening. 2 evenings.
2 evenings.
Oh, both times if you want.
You can go both times, and I will tell you that please do not look for Trattoria Amici because that one's full. It's sold out.
It's in?
It's sold out. I'm sorry, it's sold out. But we do have some excellent fun venues and some really interesting things that are happening this year. We're always looking for new ones for next year as well.
And can you let our viewers know the number to call or how they can...
If anyone is interested in getting an invitation or finding out more information, you can either call our office at 818-548-7931 or our website, www.glendalehealthykids.org.
Great. Thank you.
Thank you.
Okay.
How much is that, the tickets?
The tickets are $100.
Okay.
And we think it's a really great price for an evening of fun, entertainment, food, and you're benefiting a good local cause. The money stays locally. So.
And I even know a house that's going to have can-can dancers. So.
Oh, my goodness. Oh, and I know a house that is also going to have celebrities. We have been informed, we've not been told which celebrities will be attending diners, drive-ins, and so there are some fun surprises for everyone.
Okay. Very good. Great.
Thank you so much for your time.
You do a wonderful job.
Thank you.
Thank you.
At 2B, we have Lori Hartwell of the Renal Support Network. And Lori founded the patient-led Renal Support Network in 1993 to instill health, happiness, and hope into the lives of patients. As president, Ms. Hartwell travels throughout the country, as far as Canada and South Africa as well, to educate and inspire people with kidney disease and healthcare professionals with her stories and insight.
Great.
Welcome.
Thank you for having me. And thank you for bringing up this very important topic about organ donation and how important it is. And I'm going to tell you a little bit about my story and people across the world, across the country who are waiting for transplants. My name is Lori, and I was diagnosed with kidney disease at 2. My kidney failure was caused from E. coli bacteria. So we hear a lot about that in the news right now, and it's really important to to pay attention and make sure you wash your fruits and vegetables and cook your meat. Ultimately, it wreaked havoc with my kidneys, and my kidneys failed at age 12 completely, and I went on dialysis. And I spent the next 12 years on dialysis, waiting for a transplant. I'm very grateful that I did receive a kidney transplant a little over 19 years ago. So pretty much my whole entire life, I've dealt with kidney disease. And it's kind of interesting how, when you have something happen to you, it really sets the tone of what you're supposed to do. I think adversity introduces you to yourself. And it certainly I found out who I was, because when you have an illness, it really does test you. So through the Renal Support Network, I really tried to figure out ways that patients could help patients, because I think we have a huge number of wonderful healthcare services, but let's face it, we have a shortage. And I also found that patients, just hearing somebody else who survived, was better than any medication that I ever took, because I needed hope. So currently, right now, there are over 100,000 people in the United States waiting for a transplant. The most common, 80,000, is a kidney transplant. Now, many of you know, we're hearing a lot of things in the news about kidney transplant right now, because they're doing a lot of living donation type of transplant, where, somebody gives a kidney to a spouse, or there's all kinds of incredible stories because you have two kidneys. And but we're pretty lucky if you need a kidney, because people have a spare, and there's two of them. If you need a heart or a liver or lungs, it's a lot more complicated. So people who are waiting for those types of organs really have to rely on what's called a deceased donor. And there's a campaign in California called Donate Life California. It's donatelifeca.org, and we have it on our website. And it's really important to talk to your family and decide if you want to be an organ donor. And then if you want to be an organ donor, make sure you sign your DMV card. But also, it's really important to tell your family, and then to sign up on this website. Because a little over 19 years ago, I was camping in the mountains in Los Angeles, and I really thought I wouldn't get a transplant. I thought I'd have to live the rest of my life on dialysis. And I got a call. And unfortunately, a gentleman in his 20s was in an accident in Denver, Colorado. And he had decided to be a donor. And they flew the kidney to me over 19 years ago, and it has improved my quality of life immensely. So I'm a little biased, but I hope that you will consider that and really talk to your family. The two number one causes of kidney failure are diabetes and high blood pressure. And the statistics just came out that 1 in 8 Americans have some form of chronic kidney disease. And so it's really important, and this is the thing that I just stress, and we're all stressed, is, high blood pressure, you don't feel it. You absolutely don't feel it. And it's so important to manage your blood pressure, because blood pressure causes kidney failure. And diabetes causes kidney failure. And then there's a whole host of other things that cause kidney failure. So I just want to encourage you to really talk to your family about it, because I've really found that kidneys, people don't understand how important they are. The hearts get all the credit. The hearts, are really important, but the kidneys are the master chemists, and they manage all your fluid, they manage your hormones, they do all kinds of things, and they just don't get enough attention. So remember your kidneys. The next thing I wanted to just share with you, because it really is becoming an epidemic in this country with kidney disease, a lot of diseases. But for those of you who've been diagnosed, because this is the biggest problem when somebody's diagnosed with an illness, and this is what I found from personal experience, is that you just are so embodied with fear that you can't do anything. you don't know what to do. You can't get to a doctor, or you get 10 minutes with the doctor and you can't understand anything, or you're trying to search the internet, and that can be a scary thing because you can find scary statistics. And so what I found, and I founded Renal Support Network based on this premise, is that an illness is too demanding when you don't have hope. And we have tons of stories of other survivors on our website, which I'm going to tell you a little bit about the programs. But we have a lot of support out there because you need a lot of support to go through an illness. You need a lot of family support. You need a lot of knowledge. And that isn't met. And so through Renal Support Network, a nonprofit group that I founded, we try to provide that service to help people have the emotional will to do all the stuff that they have to do to survive an illness. From the diet to the exercise to, showing up for the appointments or navigating the healthcare system which you get a PhD after you do that, for me anyways. So let me just tell you a little bit about what we do, and I hope that you know anybody who's been diagnosed with kidney disease. Next Sunday on August 16th, we're having a free patient seminar at the Glendale Library, and it's free for you and a guest, and I'll give the number when we're finished, but you can go to our website. We're going to have people talking about different treatment options, a doctor talking about transplant. I'll be talking about how to live a joyful life in spite of an illness and give you hope that you can get through this illness. So I'm just going to give you a couple of slides on the Renal Support Network. Oh, no, I'm going to do it. And I wrote a book that talks about this called Chronically Happy. And one of the things I found growing up is that nobody really told me that I had a future. And so I think it's really important that if you have an illness, you can have a future. We basically just work with patients helping patients. And we're a group that have people across the country that mentors, and we're based here in Glendale, and we have, it's just about sitting down and talking to each other and trying to give that experience, strength, and hope. We're in D.C. all the time advocating for better health care. We're advocating for pre-existing illnesses to, not be allowed, so that it's very difficult. And I said earlier that, it's so difficult when you have an illness, and I understand that. We're trying to let Congress know that pre-existing illnesses are important, that we have access to health care. We have a radio show called Kidney Talk, so for those people who can't absorb the information from reading, it's a 30-minute fun radio show. And Stephen First was on the movie Animal House, for those of you who may have seen that movie. And one of the things that we're known for is we throw a prom for all the teenagers with kidney disease. And I spent all my teenagers on dialysis, so every January in Sherman Oaks, California, we throw a prom, and we have about 400 kids. And so we're always looking for dresses and donations. This is one of the best things that we have an 800 number, 800-579-1970, that there's actually patients who are on the phone ready to take a call from another patient. This is open Monday through Friday, and we're just here to help you get through being diagnosed. And we have a website, and we have bulletin boards, and all of this is here, and it's comes back to the core message of an illness is too demanding when you don't have hope. So I think it's really important to just, if you've been diagnosed, to don't give up, and if you're healthy, stay that way. So that's
Thank you,
I think
Lori.
that's about 7 or 8 minutes. So I'll answer any questions about transplant because I didn't know exactly if there was specific questions.
Okay, thank you, Lori, for your presentation. One of the questions I asked you when I first met you here was, are you a one-woman dynamo? You started this in your garage by yourself, and it's grown into a, not just locally. That's what's so amazing to me, because I was under the impression it was local, but it isn't. It's international.
It's gone across the U.S., and it's so, I have it's scary to think that, you know, something you just do naturally is being adopted by other people. And it's interesting now because, you know, when you're trying to pursue something and you just think there's no light at the end of the tunnel, and then all of a sudden people are like, I mean, the best form of flattering is people are copying me. And people are taking my messages, and people are changing their mission statements and putting the word hope in it. And you see these subtle changes, and it's about changing a culture. And I'm trying to change the culture of that when you have an illness, you're still valuable. You're still able to accomplish your goals. I've been talking to a lot of people in Congress, and our Congressman Adam Schiff is very much aware of my ideas and suggestions and is very supportive of them. But I'd like to see like a health corps where, you know, we take patient survivors and put them back into helping other people educate survivors. You know, we just don't have enough healthcare professionals. And there's this huge untapped resource in the community that could be mobilized. But they just need the tools and resources. And that's kind of my vision, and I continually am out there because what's really interesting is when I started this, and I went around, and I'm a professional patient. I mean, I know the system backwards and forwards and sideways, and I just saw all the areas that were, you know, the inequalities were there, the inequities in care, and just started filling in the gaps. And so I always encourage people, you know, if you see that need, just go fill it. And it's amazing how people, you know, eventually catch on. So yeah, it's been really exciting to see.
Good. Commissioners, any questions or comments from any of you?
I have a question.
Commissioner Manasari?
Lori, are you affiliated with hospitals? Do you work with local hospitals? Are they aware of your network?
Well, they are. Some of them, like a lot of pharmacies, sometimes request our information to put our 800 number, like our Hope Line, dialysis facilities, transplant clinics. They want, like, the literature. Right. But it's a constant education because there's so much turnover at these facilities. I was at one, and, you know, I'm like, I was, you know, this is where I was taken care of, and they don't, you know, a year later, if I'm not right in front of them, or if somebody's not right in front of them, it's the turnover. So you constantly have to go back and re-educate people, and we try to offer a service. We have a support group here in Glendale. You can go to our website, and, you know, patients come to the support group because they need the information. They just don't know what to do. And that's where I think there's a lack in the system. They need, like, navigators to go around and help them. And, but yeah.
I just think it's so great now that the hospitals are reaching out to the community and doing more community outreach. You know, your network would be wonderful to have as a resource for all the patients that go and get treated in all the local hospitals. So
it's needed. It's so needed, especially there. You just, you know, if you lose hope, you just don't, you know, have the will to do what you need to do. I agree.
Mr. Sobey?
Lori, was it about 19 years ago that you realized for the first time that you had a future, or did you know really before that? And then how did you quickly assemble goals now that you knew you'd be living for so many years?
Well, you know, this is one part. Well, I had some transplants that didn't work when I was younger in the earlier stages, so I was really told I would never get a transplant. And at age 17, I got a transplant that didn't work. I never really... And I was told I would never get a transplant. So I really made a decision. Like, you know, and I think when you're a child, it's a little bit easier to adapt than when you're older, because you can adapt to change. But I just, like, you know, I just have to live my life this way. And I didn't know much different. I mean, I kind of grew up sick. Mm-hmm. So technology kept getting better. So I kept getting a little bit better every time a new advancement came out. And so, yeah, I was decided, well, you'll never get a transplant. So probably about age 17, I decided, like, I got to either, you know, I could sink further in despair or beat the odds and live the fullest life I could. One little secret is I was born in Las Vegas, and they kind of teach you to play the odds. You know? So that was when I really started, you know, and I had, the first job I ever had was the best job in the entire world. And that's delivering flowers. Oh. Because everybody is happy to see you. So, it really made me be around a lot of happy people, and I think that helped me. So.
And you decided possibly that you wanted to work with people.
I wanted to work with people, and then I got this really great idea that I should just be in the dialysis and transplant community, because why wouldn't anybody want to hire me? I'm like a professional patient. I know all this stuff, and it was hard. It was really difficult because people saw me as a patient, not as a person. And I had to break through those barriers. And it's funny now because I'm on national boards, and I have health issues, and they don't see me as a patient anymore. They see me as a person. And I think that's what we need to really do, is we need to get in the game and play and show people who we really are, because when they know who we are, we're just another person and part of humanity. And then they can embrace our ideas.
And where do you live now?
I live in Glendale. I'm married to Dean Hartwell, who works for Glendale, who, by the way, has the best insurance. I love their insurance plan. So, it's, we live here and we love Glendale, and so Glendale's our home.
I just have a question about how difficult is it to find a match for kidneys, and does it have to be age related, the same age as the patient?
That's a really good question. Well, advancement's amazing right now, because right now in Southern California, a wait for a kidney is about 5 to 7 years. That's the waiting time. Now, if you have enough money to go to Oregon, it's about 3 years. So it's all very disconnected around the country. There's different pockets, which is a whole other thing patients need to learn. But they have to measure blood type. But that's even changing. Like O can give to O positive and O negative, so it can switch, or O can give to an A. There's some leniency there. But the thing that's most incredible about transplantation now is that they're doing something called, they call it the train or the domino effect. So let's say if somebody wanted to give you a kidney and they didn't match, then they could put themselves in a pool and they would do like a swap. So that kidney would go to somebody else, and then they organize these trains. And so it's giving people a lot of hope that had somebody who wanted to donate a kidney to them but didn't actually have a match in their family. So a lot of progress is being made there. It's kind of a newer program. So it's not, I don't think, that hard to match somebody if there's a big enough pool. It's just the need. There's such a great need, and our policies in the U.S. are what's called an opting-in system. So you have to sign the card. In the European countries, they have what's called an opting-out system. So you actually opt out, and I don't think that will probably happen here, but that is a way to really increase the organs available. But there's some skepticism on that. There's also some discussion about incentives, about one of the things that would like to explore is maybe a tax incentive or some kind of incentive if somebody donates a kidney, that they have some kind of, they have to take work off of, there's no compensation, which I don't think there should be, but a lot of times people can't give kidneys because they can't take the time off. So there's some things being tested in Congress, some pilots, and it's just complicated because there's such an incredible gift of life, and I can't wait till the day they can grow the organ, and I think that will be really incredible, and that's not far away.
Why were you initially told you could never get a kidney?
Well, what happens is that you develop something when you've been as sick as I have and had a lot of blood transfusions. I probably got about 150 units of blood before a drug called EPO was invented, which was an injection. And now most people get EPO instead of blood transfusions. But when you're getting blood transfusions, it creates antibodies. And when you don't want antibodies when you're looking for a transplant, because it makes your immune system higher. And now there's some new treatment now to help reduce the antibodies. So that's, there's a lot of exciting technology But it is a priceless gift, and I'm forever grateful to my donor who decided to make that decision, because who knows,
Have you met your donor?
I didn't. It was a deceased donor. So it's but I have a screensaver of Denver, Colorado, and that reminds me that somebody, and all I know is he's in his 20s, and that's all I know. And I think it's remarkable, and I have to give him credit for everything that I've done, because it can be, and I know you guys know this, a male-dominated world, and they don't know that I have a male kidney. So I have a secret weapon.
Lori, this is...
Sorry, bad humor.
That's
but
wonderful.
I just have one other question. You mentioned about people taking the time off work or whatever
Right.
to recover. What's the normal length of time for the transplant procedure and for recovery?
Well, the recovery varies with each person, but they're getting very better because they're getting better at it because they have laparoscopic surgery. And it's what I've heard from people who've given a kidney. It can be they're in the hospital a couple of days, and literally, a week or two, they're back to their normal routine. It used to be a lot longer because the surgery was more intense. But I think they recommend, it's going to be a couple weeks. I mean, I think they should take a vacation. I mean, they deserve vacation. But it is, and there's a lot of testing. You have to go, you need time off work to go get tested and get blood drawn, and it's you need follow-up care. And one of the things we have to be really concerned about too, that we've been advocating for, is that we've heard of some insurance companies disallowing people who've donated kidneys as a pre-existing illness. And so we've had some cases of this, and because they've written on their health care form that they've donated a kidney, and so we're trying to combat that. And again, it's like and there's actually been studies that there's no difference because they screen you in your life expectancy. So,
Well, if there's anything that the Commission could do, I'm sure on behalf of the Commission, we would like to help support some of the legislation that you'll be working on.
that would be wonderful. Right now, there's a lifetime immunosuppressant drug bill, because one of the things that's crazy is that, and we're very lucky if you have kidney failure, we can access the Medicare program. And Medicare is the only entitlement program for a specific illness in this country. So we have somewhat of a national care. I'm here because of Medicare. They picked up the cost of my transplant. But after your transplant, they only cover you for 3 years, because by then you're supposed to get a job and have insurance, and the insurance will pay for your medication. Well, that hasn't happened for many people who've had transplants. So after 3 years, if they can't figure out how to afford their meds, what happens, they can't take them, they end up losing the transplant and going back on dialysis. And the government pays for you to go back on dialysis. So there is a bill, there's huge support, and actually the House version of the bill has lifetime immunosuppressant drugs in it right now. Hasn't been voted on, but the Senate side does not have that language yet that we know of. And so please call Senator Feinstein and Senator Boxer and any senator, and just let them know Congressman Adam Schiff is very much in favor of this bill. And it's the lifetime immunosuppressant drug bill, and I can't remember the number, but it's on my website. It's on our website, rsnhope.org. And that's something currently right now that could help legislatively. But I think we do need to push for more prevention and, more ways on helping people with their lifestyle choices, things with that nature. Because I can tell you, so many people don't even understand how their body works. And it's really hard when you don't understand that. So anything that you can help with either high blood pressure or diabetes. But right now, the immunosuppressant bill is currently in the legislative channel.
Well, thank you, Lori. You know, you have so much information that I know is valuable, and we should all have. You were going to tell us about the salon or the lecture that you're giving in August. Can you give us information on that? So if anyone wants to.
Sure. It's August 16th, this Sunday, and it's at the Glendale Library here. It starts at, I think, 12:30 to 5. Registration is free. Just please call us, and you can call us at... I should remember, my toll-free number is 866-903-1728 or 818-543-0863. And you can register online at rsnhope.org. And we hope that you'll come out. Lunch, we have free lunch for everybody, so come on out and see us and learn about kidney disease.
Thank you very much. Thank you. You know, transplantation is important not only for kidney disease, but for a lot of other diseases. So it's important that people get information about it, learn about it, and hopefully we'll one day have no need for transplants. We'll just have enough of them. That
I know. As soon as they can grow them.
Yes.
I brought everybody, though, a kidney today because I know you can always use a spare, and we can pass those out to everybody. My assistant, Dean Hartwell. And yes, and please let us know if you have any questions or if you need any information. And I'm going to leave some literature. Is that okay?
Sure. Great.
And a complimentary book.
Wonderful. Thank you very much. Okay. Okay, Ms. Baboubian, next item, please.
At 3, we have oral comment. Discussion is limited to items not a part of this agenda. Time is limited to an amount to be set by the chair. The commission may question or respond to the speaker, but there will be no debate or discussion. Staff may refer the matter to the proper department for investigation and report.
Okay, I have no card, so we'll have next item, please.
At 4A, consent items. Approval of the minutes of the regular commission meeting held on July 13, 2009.
Do we have any corrections from the commissioners on the minutes? If there are none, do I have a motion to accept the minutes as presented?
I so move.
Second?
I second. Oops, I wasn't there, so I guess I should.
No, you should. You can't. You have
I can't. Yeah.
I'll second.
And we have a consensus?
Yes.
Yes. Okay. Next item, please.
At 5A1, Commission on the Status of Women Master Calendar Events 2009. And at A, we have a motion providing direction regarding the Commission on the Status of Women Master Calendar of Events.
Okay. Any comments from my fellow commissioners? Calendar? I just want to take note or make note that Session 2 of Camp Rosie is now going on, and as Camille mentioned, she was there today speaking. Commissioner Manasarian and I have been there, and Commissioner Sobey has been there, and I encourage the other commissioners to try to make it to one of these sessions because they're just fabulous, and the girls. We have a really ethnically diverse group this time, and just really energetic young women. I want to take the opportunity now to thank Commissioner Malakian because she came down when we had a forum, and Board Member Nahabidian was there, and Councilman Laura Friedman was there, and Commissioner Malakian joined in. That was really nice of her to do that. So I encourage the commissioners to come. And any other comments about the calendar? Shall we accept them, the calendar as they appear, as it appears? Yes. I have a motion. Do I need a motion? No. Okay. All right. Next item, please.
At 2, we have consideration and approval of co-sponsorship of Glendale Adventist Medical Center's Educational Stroke Luncheon. At A, there is a motion providing direction regarding the co-sponsorship of Glendale Adventist Medical Center's Educational Stroke Luncheon.
Okay. Ms. Baboubian, you want to give us a brief report on that?
The Glendale Adventist Neuroscience Institute has asked the Commission on the Status of Women to co-sponsor an educational stroke luncheon titled Surviving Stroke, Updates and Local Treatment Options. The event will be held on Thursday, September 17 at Glendale Adventist, It will begin at 11:30 a.m. and will include a presentation by Dr. Lance Lee, who is the Medical Director of Stroke Services at Glendale Adventist, as well as a question and answer session. The purpose of the event is to educate the community at large about the dangers of stroke, as well as treatment options and prevention. The luncheon is provided by Glendale Adventist at no cost to those who wish to attend. At the luncheon, attendees will receive reusable bags provided by Glendale Adventist. In addition, attendees will have the opportunity to participate in raffles. There will be gift baskets as well as 3 certificates for a cerebral vascular profile for evaluating the carotid artery. And the very lucky recipients of these certificates will be able to schedule an appointment for this evaluation at Glendale Adventist at no cost to them. The radiology department will provide them with the results of the evaluation as well. And the Glendale Adventist has asked the Commission to co-sponsor this event by providing the gifts that will be placed into the bags that will be distributed at the luncheon. This would include the current promotional material that we have on hand, which includes pens, sanitizing spray, emery boards, and our Women Vote bumper stickers. The quantity would not exceed 100. And in addition, the Commission was asked if we could provide 2 gift baskets for the raffle. We do have gift baskets from a previous event that can be utilized at this luncheon. Glendale Adventist will cover all other costs for the event, including the location and food.
Great. This is going to be an amazing event. And also to add, besides Dr. Who is it? Dr. Lance Lee. Commissioner Manasarian will also be a speaker, and she's going to talk about her experience at Glendale Adventist, and it should be quite interesting. Do you want to, Commissioner Manasarian, add anything to this?
I'm kind of excited because I was asked to share my experience at the Glendale Adventist while I was a patient there at their intensive care unit, and so I've been through their program, and I've been through their all their treatment, and I was very pleased, and I'm very happy to be able to share it that day. So come on down, and we'll have a great day. Very informative.
Any questions from the commissioners?
Just to confirm, that's Thursday, September 17th at 11:30 a.m.
Yes, and we have a reservation number if you'd like to call. Remember, lunch is free, and the number is 818-409-8100, and I think you should mark your calendar, save the date, and be there. It's going to be, they have videos that they're going to show on actual brain attack surgeries, and it's just going to be most interesting, and I encourage everybody to go. It's really important for all of us to know about stroke and the symptoms and how we can prevent and what happens, and so this September 17th should be fabulous. So I hope everyone will be there. Let's see. I don't think I need a motion. We'll just. Am I asking for a motion? Okay. Do I have a
motion?
A motion that we take part in this event with Glendale Adventist?
And specifically, I think, Madam Chair, if I may, I think the request was that you co-sponsor and commit to certain gift baskets. Am I not correct in that? So you want your motion to include that?
2 gift baskets and items to go into the gift bags. Do I have a motion?
And we already have those gift bags.
This will cost us nothing.
Yes.
The fiscal impact. So do I have a motion?
So move.
I just have a question.
Sorry?
Is there an amount for the gift baskets that they wanted?
Are they stroke-oriented in theme?
I don't know what. I think, Ms. Babubian, do you have an answer?
The gift baskets are gift baskets that we have left over from a previous event.
Mm-hmm.
They're just general items, but they will do like a Q&A session, and people who can answer some of the questions will be able to get the gift baskets. I think that's how they're going to do it.
And do you know how much the raffle will be?
The raffle is free.
Free. There is no cost on the raffle. They're raffling these exams for free. So it's amazing. Their radiology department really stepped up and said, we want to support this event, so we're going to to offer, and I want to get it right, evaluating the carotid artery, the cerebral vascular profile. And then they're going to follow up and with the three that win them and do whatever needs to be done. Okay. Did I have a motion on this then?
I said so move.
Second?
I'll second.
Shall we take a vote on that? Or do I have unanimous consensus?
Yes.
Yes?
Yes.
Okay, fine. Next item, please.
At 6, we have commission and staff comments.
Okay, so quick meeting tonight. So let's, it's August, and okay, so we'll start with Commissioner Lamel. Would you like to make any commission comments?
I would just like to thank the two speakers, Ms. Levy and Ms. Hartwell. I think it's just wonderful to know about the options that we have here in Glendale for health care, and especially with this difficult time financially for so many people. It's wonderful to hear the hope that's available for our community. So I just really hope that we'll continue to support programs like that, and for people such as these two ladies continue to come to the commission and share that with the community.
Commissioner Manasarian?
Yeah, I also wanted to thank Camille from Glendale Healthy Kids and Lori for the informative program we had. I also wanted to invite the audience to participate with Guess Who's Coming to Dinner program, which is a wonderful, wonderful fundraiser, a lot of fun, a lot of community participation, and I strongly encourage everyone to come out and support that wonderful program. I also wanted to mention that Glendale Adventist has a new program called Healthline, and it's being aired actually I think on Tuesdays, but it's a new program, and they're going to be addressing different topics. Glendale Healthy Kids is one of them, and so they've also asked us to participate and support that project. So I'll encourage everyone to watch Channel 280, Healthline for Glendale Adventist. Also, I wanted to mention that Commissioner Chair Devine and I went to Junior Achievement Finance Park. Commissioner Sobey. And also Commissioner Sobey. We all participated in Junior Achievement Finance Park, and actually we went through an exercise. We became, I think we became a 25-year-old together with one child. We were given a card and a certain amount of budget to go with and work with, and we participated just a little bit to see what our girls in Camp Rosie are experiencing, and it was very informative, very impressive, and I encourage all of you, if you have a chance, to stop by the Junior Achievement Finance Park and see that park. It has small areas made out like stores, like a Toyota store or a bank or a restaurant, and the kids get a little bit taste of a real world, and really they figure out how to manage their finances and budget in the real world. And a lot of them come out surprised that how come they understand actually how come their parents can't afford a lot of things. So I was very pleased, and I think Commissioner Sobey and Chair Devine, really we had a good time that day, and we want to thank the Finance Park and Adam Rubin for supporting that for Rosie. Also, Rosie Goes to Wall Street. Again, I can't really emphasize how wonderful that program is. We spoke to the girls. They're so happy to be there. We're happy to be there, and they're learning a lot. And I think it's a great program, and we thank the community for supporting such a great program for our girls in Glendale. So thank you all.
Thank you, Vice Chair. Commissioner Pillsbury.
I was very struck by both presentations tonight, both because of our commission priorities. This year we're focusing on women's health, and those were two excellent presentations on health. And next year we're focusing on the volunteer, on women helping women. And both of these organizations started here in Glendale. They serve the Glendale community. Countless numbers of dedicated people put in hours and hours and hours for both of these organizations. And I thought it was something that we should be celebrating, on everybody's commitment to our community. So You're doing a great job, both organizations.
Thank you. Commissioner Sobey?
I just really want to emphasize the community attendance at Guess Who's Coming to Dinner, whether it be Saturday, September 19th or Sunday, September 20th, because when we can mix up fun and charity, I think that's the best combination there is. So, be generous. It's a fun evening and it's a great cause.
Commissioner Walker?
Well, speaking of fun and charity, I was privileged to attend 2 major events this month, and one was a private sneak preview fashion show and arts for a major event called Passion Revealed, which is a fusion of arts, music, and fashion, which will be held on October 16th at the decommissioned historic Viviana Cathedral, and everybody's invited to attend that. It's going to focus on thriving and prominent artists in the fields of music, fashion, and arts. And a lot of those artists live in the LA County, so we're excited about that. And the second one is a film festival for the movie called Disarmed, and that movie was filmed entirely in the Philippines, and so we're happy to partner with them, and it was nominated for 7 awards, and I want to congratulate breakout star A.J. Draven for winning that award. And the other exciting thing about this is that they're going to be doing their red carpet and their premiere showing, and guess where? None other than at our Alex Theater. So we're excited about that, the way that they're going to be bringing the movie industry here, and the different organizations and their commitment especially to hiring a lot of ethnic minorities and groups in their movies, and so we want to thank them for that. More information will be given. It's going to be in October. And lastly, we talked about health, insurance, the medical issues, and so on. And I know you've heard a lot of these town hall meetings and so on. And our very own Congressman Schiff is sponsoring, a health awareness, insurance, medical town hall meeting tomorrow in Alhambra. I believe it's at the Alhambra Civic Auditorium. Yeah. So, we're encouraging the community to participate, get to know the different issues, get to know what's, to clarify misinformation about this very important legislation package that's being passed by the current administration. And if you have any questions, do contact Congressman Schiff's office. Thank you.
Commissioner Malakian?
I really enjoyed going to Rosie Goes to Wall Street. For that one day, I wasn't able to attend the second session, but I thought it was really interactive, and I thought they were doing a really great job just because of the discussions and the questions that even I was asking at certain points. So it was very interesting, and I had fun.
You know what? That's actually really cool because I remember I was looking at the calendar and I realized that the second session started. And I remember last year I actually attended the second session, and I'm even more happy to realize that Chair Devine just mentioned that it got more ethnically diverse. So that's even really more awesome. And I definitely want to do something like Talar did and visit them. I mean, it would be cool to be like a big sister or whatever. So that'd be awesome.
Okay, we still have this week and next week, and we'll be having another forum, and we would love for you to come. I called you last week to come, and you weren't there, and I couldn't get you. You were probably at school, because I would like for you, and I'm sure the whole commission would love for you to come down and speak to the girls. So maybe you can arrange something with Ms. Baboumian. Okay, that would be great. That would be great. I, too, share Commissioner Pillsbury's feelings about our focus on women's health this year. I think it's been absolutely fantastic. We have our speakers for September and October, and so I would like to invite the community, those of you that are watching out there, if you have a health issue that you would like for us to cover at one of our meetings in November or December, please call. Ms. Baboumian, would you give the information, your number, and the website, so that if anyone has a health issue that you want us to bring in a speaker. We'd love to do that for you.
They can call me at 818-548-4844. They can send an email to women@ci.glendale.ca.us, and there should be a link to that on our website as well, which is www.glendale.ca.us/women.
Great. Okay. We hope to hear from some of you. I do encourage you again to attend the Stroke Survivors Seminar on September 17th. Also, thanks to Commissioner Sobey, Glendale Memorial is going to be presenting a breast cancer seminar and a melanoma. That was the one that she particularly requested, and we'll be agendizing those two next week, or next month rather, and talk about those. So put those on your calendar. One is on November 17th, and the breast cancer is on October 13th, and the RSVP number for those, and those are also free, also have lunch, and all the information is 818-502-2378. And last, I would like to congratulate Commissioner Sobey on becoming a grandmother for the first time, a little boy, and we congratulate you. And I know that you're just happy as can be.
Luke Ford Sobey, almost 9 pounds, 20 and a half inches.
Okay.
On July 30th.
Great. And on that happy note, can I have a motion for? Oh, I'm sorry. And happy birthday, Talar. Good for you. How old, Talar? See, we can ask when she's this young.
17.
17. Beautiful, beautiful. Ms. Baboumian?
If the commission comments are done, I would like to make an announcement from staff.
Sorry, I didn't ask.
We did get an email from the City of Los Angeles Human Services Department. They are partnering with LA Derby Dolls to bring a free job fair for women. It's titled Women's Resource and Job Fair. Like I said, it's free admission. They will have a free light breakfast and lunch. They will be providing information on low and no-cost career training. They will be providing career advice. They will identify new job markets for women and for the county as a whole, and they will meet with employers and recruiters, and they will offer free legal services. It is on Saturday, August 22nd, from 10 a.m. to 3 p.m. at the LA Derby Doll Arena, which is at 1910 West Temple in Los Angeles. And those who are interested can call the City of Los Angeles Human Services Department at 213-978-0300.
Great. Job opportunities and job training. And on that note, also a good one. Let's hope that's a success. Do I have a motion for adjournment? Second?
Second.
We will be adjourned at 7:20 p.m.
7:40.